African American rhinoplasty is something we really love, and I think we have a real expertise in. What we've learned over many years is that the approach to African American rhinoplasty has to be very different than what's traditionally taught, based on techniques that were really developed for a different type of nasal anatomy.
Yeah, it's important when you're thinking about getting African American rhinoplasty to go to a practice that really specializes in noses, but even more specifically, that has a lot of experience with different ethnicities. Our own practice, I'd say, God, maybe 75–80% of our patients are various ethnic groups, whether that's African American, Hispanic, Asian, Middle Eastern, and because we super specialize in this practice, in doing these different types of noses, understanding the different aesthetics as well as the functional requirements for different noses is really important.
The aesthetic goals are really a major focus, and I really credit Dr. Solieman with having a very nuanced idea and understanding of, during imaging, really how far we want to go. We're establishing those goals that really make sense for people, that fit their features, that are going to be a nice change, but really also look natural and look like they've never had a rhinoplasty, is really the very critical starting point of understanding where to go.
Yeah, I think it's really important when you talk about most African American rhinoplasty, there's always a gamut. So if we're sounding like we're generalizing, it is important to understand that we are very cognizant that within every ethnic group, you really do run the entire gamut of thin and thick and wide and small nose. So we are generalizing, but it's important as a generalization to sort of say most African American patients who present, their major concern is that on front view, their nose feels a little too wide. Unfortunately, for most practices, I think the answer that they're going to get is you need to work on the profile, build the bridge up somehow. And I think what we've really decided is that that's a flawed approach to that idea, because what it really does is it creates this idea that if you camouflage the bridge height, that somehow by making the nose higher, it makes it look thinner, when it really just makes the nose look bigger.
I think a very common fear for a lot of our African American patients who come in is that they're going to look overdone. They're going to start to look pinched, like a lot of African American celebrities have. And our answer to them is that doesn't have to be that way. Really, when the goals are set properly, and I think what really people are looking for is they want a natural change. They want something that looks smaller, a little more delicate, a little bit more fitting for their features, but where they still feel and look like them. And they can go back to family, friends, colleagues, and have people look and say, oh, you look good, but not really know why. And I think, when you have the right aesthetic, the right approach, and then understand the techniques that are necessary to accomplish that, that's where it all really comes together in our practice.
Yeah, it really is important to maintain that ethnic identity, to make sure that the result that you get still is ethnically appropriate. And then the next conversation, once you understand the aesthetic, is how do you do this sort of nose. I think that there's no question that doing this through an open approach allows us a whole host of strength in allowing the skin to be able to contract down to the result that we want it to do. Most patients think that they have too thick of skin, and I think we have sort of disproven that idea. If you look at our results, you'll see that patients can get fantastic results, and it's because there's a real understanding that it's not a problem with skin thickness. There really is this fibrofatty layer of tissue underneath the skin that overlies many of our African American patients, where no matter what you do to the cartilage, if you don't deal with this fibrofatty layer, the skin simply won't get down to the level you want, and it's going to look like nothing's happened. And that's probably one of the most frequent things we hear from patients who've had surgery somewhere else is, it just kind of didn't do anything for me.
Yeah, which is really the best case scenario is in a practice that's maybe not that comfortable doing African American noses, is to do a little less. And a lot of patients come back saying it wasn't enough of a change. But we'd always prefer that than surgeons who try to be too aggressive and end up creating some problem. I think by doing it through an open approach, we're able to really thin out that fibrous fatty layer of tissue so that we're able to allow thicker skin to behave a little bit more like it's thinner, to actually contract better around the new structure that we've created underneath, which brings us to the second really critical point of African American rhinoplasty, is creating that tip structure.
Yeah, that's really, really important. The cartilage itself tends to be a little bit softer, so it really is important about bending that cartilage into the proper shape, using septal cartilage where necessary, and other cartilage if it's really necessary, to really lengthen the nose or project the nose to the proper position, and then fix it in that position so that that skin can really wrap down and give that definition that we're all looking for. Again, always bearing in mind that you want to be ethnic appropriate, and that goes into the next part of the conversation, which is alar base. And when we're talking about the width of the nostrils, one of the things I turn around and give credit back to Dr. Litner about is this real unique approach that we have to alar base reduction and how to bring the nostrils in a natural way.
And again, that's a point of fear for a lot of patients, is they worry about having that tethered, kind of really triangular, pulled down look to the nostrils.
Paste it down.
When it's done properly, that shouldn't happen. And our focus really is on two things with the nostrils. What we can change with nostrils is we can change width, but we can also change the sense of flare or rounding. And a lot of African American patients have a combination of both those things happening. So approaches that deal with one or the other exclusively, there are techniques where you're really just taking out the curved part of this bottom of the nostril to remove flare. If you're too aggressive with that, that's where you get the risk of straightening the nostril too much and having the look pasted down. Our technique really focuses on taking away some tissue from inside the nostril, and then that allows us to actually pull the nostril in to preserve that natural rounding, preserve that natural curvature that every nostril should have, so it looks like your nostrils, just narrower and a little bit more defined.
And that's really ultimately the key, is really accomplishing the goal, making sure that the skin is able to contract down, that there's really some structure underneath it for it to get down to, and then doing that alar base in such a way where that they can really get a natural result. There's no pinching, there's no excessive rounding, that part of it is removed, but it's still ethnically appropriate. It's still going to look like you. And honestly, if you don't tell family, you'll be surprised. A lot of patients come back and say, you know what, I love it, the result looks great, but people didn't even notice, because it's going to just fit. It's going to feel right for your face, and you're no longer going to feel like your nose just overwhelms your face.